After this investigation, the 22 News I-team traveled out to Boston to find out what the state is doing in response to the spike in overdose deaths.
A week of detox isn't enough.
West Springfield's Rodrigo Gordon is 4 months clean, but has struggled with heroin use for years. As he works on his recovery day by day, he, like so many others who have overdosed, are also looking to the state for more resources.
I've had friends who passed away from trying to get into treatment, who were on a waiting list. Took, like some people I've talked to, took 3 months to get into a treatment facility.
In June, the state's opioid task force released its list of recommendations on how to combat the state's drug crisis. It's now up to the Department of Public Health to enact the changes. So the 22 News I-team went to Boston to find out what they're doing and when we'll start noticing a difference.
One of the biggest things we hear is treatment beds. We need treatment beds, so those procurements were prioritized.
DPH's Hillary Jacobs says right now they're actively working on new prevention campaigns. They've already expanded access to support groups and are working on expanding access to Narcan, which stops an overdose in progress. And she says by next April there will be 128 more detox and recovery beds across the state.
How much of this is happening in Western Massachusetts as well?
All the services are regional, so we try to make sure that anything that exists in one region of the state exists in all regions of the state.
She says they made some changes immediately that didn't require money. Those that require funding take longer, but they are working their way through the recommendations.
And for a look at those recommendations and useful links, if you or a loved one is struggling, the I-team, we've put some up on our website, wwlp.com.